Welcome, everyone. I'm Brooke Lovelace, Executive Director of the Iowa Developmental Disabilities Council. We are super excited to have you here on, well, I guess this is maybe not exciting, but this is actually our last Capitol Chat of the summer. It's hard to believe that summer's almost over and the legislative session is going to be here before we know it. So just a couple, we've got a couple of great guest speakers today that we're going to get to here soon. We've got Erin Prangley, who is our Director of the Public Policy National Association for Councils on Developmental Disabilities, which is the national organization that the Iowa DD Council is part of. And then we also have a member of the Secretary of State staff, Bailey Kelly, who will be giving us an election update as well, too. But before I turn it over to Erin to do a federal update, I do just want to do some quick housekeeping. You should hopefully have an interpreter that is pinned for you. We also you should be able to access closed captioning. If you hit the more button, the three little dots there in the corner, you should be able to select closed captioning. We did just find out this morning that they've changed the settings a little bit on closed captioning, so it might look a little bit different on your screen, but that should be available. There should be plenty of time for you guys to ask questions if you have some questions. So with that, I think we'll go ahead and get started with our Capitol Chat, and I'll turn it over to Erin.
Thank you so much for that gracious introduction. Again, my name is Erin Prangley, and I am the Policy Director at NACDD. I work and live in the Washington, D.C. area, and I'm always happy to meet with you. So I appreciate the invitation. I hope to have some time for questions, but let me just give you a general overview of the work that we're doing in the national office. As you know, Congress is in recess, which means that this is the time where they are going to be in the states and in the districts listening to constituent voices, doing extremely important work. And I hope you've had a chance over the past couple of weeks to at least pay attention to where your members of Congress are, what they're doing. There have been fewer and fewer town halls, but remember, the constituent offices are always open for you to just drop on by and say hello. The recess period is supposed to end next week. Interestingly, we're hearing rumors that some members of Congress would like to extend the recess time, but frankly, they don't have time to do that. The reason is that our laws require that Congress come up with a spending bill by the end of September in order to begin their October 1st fiscal year. You all are from the DD Council. You understand how important budgets are to make sure that we have the money in hand to be able to do the important work that you all do in the state. Well, every year, Congress struggles to meet their deadline of October 1st, and they enter into things called continuing resolutions to make sure that federal grantees, such as the DD councils, have the money they need in order to do their work. So what does that mean? That means that we only have about 4 weeks to come to an agreement in both the House, the Senate, and the White House as to what these final numbers will be. It's a little confusing because some of you may recall before Congress went into their vacation recess, they passed something called H.R. 1, or the reconciliation bill, or what the press like to call it, the one big beautiful bill. This was a gargantuan, huge piece of legislation that made devastating changes to Medicaid. I want to thank you all for the stories, literally thousands and thousands of stories from your state alone that came in to explain to members of Congress why these cuts are devastating to the disability community. NACDD made over 100 in-person meetings with Republican offices. We made this bill better, believe it or not. It could have been a lot worse, but it's still devastating because of the changes it makes, which will shift the cost burden for Medicaid services from the federal government to the state. So many of you thought, oh, I guess the budget's over, but that's not the whole picture. That dealt with Medicaid. And we will be working on implementing Medicaid in the state and the changes that include work requirements, for example. But right now we're going into the annual appropriation, which is where Congress drills down to the actual dollar amounts it will give to the non-discretionary programs, such as how much money for education, how much money for health, how much money for defense, how much money for agriculture and SNAP. So all of these decisions are being made right now in the appropriations committees. The Senate finished their work on the appropriations numbers, and I have some really good news. Before they went out on vacation, the Senate decided that it would ignore the president's budget, which called for over 20% cut across our agency, and pretty much kept all of the programs intact. The Senate refused the president's request to create a Make America Healthy Again agency, and he kept all of our agencies, and sorry, the Senate kept all of our agencies, such as the Department of Education and the Administration for Community Living, intact, didn't make any changes. This is really great news because President Trump and his cabinet have proposed making huge changes. They propose getting rid of the USEDS, for example. And many of you were active to tell members of Congress and the Senate, don't get rid of the USEDS, and they didn't. So the good news is that the Senate has rejected a good deal of the president's budget in favor of funding the critical programs that we care about. The bad news is that it was only level funded. So we're not seeing the increases that we need. This is the same number we're looking at today that we saw 4 years ago. And clearly that is not keeping up with the need. Clearly that is not even keeping up with inflation. So not great news. And in normal times, we would have a different strategy. But in these times, we're counting the Senate's level funding as a win and as a rebuke to the president and others who would eliminate programs such as the USEDS and many of the protection and advocacy programs. And they did level fund our DD councils. Moving into the process, the House has to approve those numbers because under our Constitution, the House and the Senate have to agree to the funding numbers, and then the president needs to sign it. We are not as optimistic about the House coming back in and maintaining these funding numbers. There's a lot more dissent in the House. So when the House comes back, they will mark up these bills, and we will be actively involved in meeting with members on those committees to make sure that the DD councils are funded at the appropriate levels, that education is funded, specifically the Office of Special Education Programming and the IDEA titles that we care about so that teachers have training and access and students have access to public schools. So aside from appropriations, we also have a new-ish attack on civil rights by the administration. I will be putting into the chat a link for something called a comment. NACDD has done an action alert to ask all of you to submit a comment to, I think it was the Department of Labor. Yeah, Department of Labor. To oppose the regulation that would eliminate overtime for direct care workers. As many of you may be aware, a decade ago, the disability community went through a painful process with the long-term care providers to come up to a compromise and support. We've been working hand in hand with direct care providers for over a decade now to make sure that we're attracting the best talent possible to do the work that needs to be done for supports. Somebody asked, I'm sorry, one moment. Deb Hobbs asked, how did the Iowa senators vote on it? This was a bipartisan bill, and all of the Republican senators voted in committee to approve those numbers. There were only 3 senators who voted against the appropriations bill. Those were all Democrats, and they did it for mostly partisan political reasons, saying that they didn't want to approve anything that this president is doing because he's just going to ignore it anyway. So I don't want to get into that, but all the Republicans voted in the Senate Senate committee in favor of these numbers. Getting back to the regulation, it's very important that we flood the Department of Labor with support from the disability community for our direct care workers. As I said, agreeing to overtime was a negotiated thing that we did. But the fact that this administration would go after long-term care supports in an administrative way instead of through Congress is really a backdoor approach to hurting a lot of the communities that we care about. Why would the administration do this? Well, remember, Medicaid is one of the larger providers of long-term care services, right? So they're just doing this to try to save money. They're doing this to try to lower the costs of paying for providers so that they can once again attack Medicaid and take that money and use it for what they consider more important priorities. So I'll put that link in the chat. There are probably a lot of questions you have. Congress is a little distracted right now with some other issues, but for the main part, the disability community will be watching very closely how it decides to fund important programs such as the DD councils, SNAP food benefits, housing, transportation, and education. If you have any questions, I'd be happy to try to answer them.
Anyone have any questions for Erin while she's with us today? Oops, feel free to raise your hand or put them in the chat. Got a quiet group today, Erin. This is normally not the case.
Well, I got to tell you, I'll take this minute again to repeat what I said in the beginning. Everybody's feeling a little exhausted right now because of the hard work we did on the Medicaid bill, or HR 1. It was a loss, but let me tell you why I feel better than I would have otherwise. We were able to get a few things in that bill that could be helpful to us in the future. For example, Senator, I'm going to forget his name, Senator from Missouri. We met with Republicans who had never even heard about Medicaid's role for people with intellectual and developmental disabilities, with HCBS. They didn't know what it was. We did a lot of educating. And one of those senators that we educated was really upset. He has a son with a developmental disability, Senator Schmidt. And he put in a provision there that in normal times we would be celebrating. As many of you know, in order to qualify for home and community-based services, you must prove what's called an institutional level of care. This is a very high standard that many people can't meet. I know they call it the donut hole. I know a couple of friends who would benefit from home and community-based services, but they're not at an institutional level of care, so they can't get that support. Senator Schmidt now his provision created a waiver for states to pay for home and community-based services for people who do not meet the institutional level of care requirement, but nonetheless need supports and services based on their disability. This is huge. We've been trying to get this ever since these waivers were created. Senator Schmidt also got in there 150, not a lot of money, but I think it's like $150 million to help states create these waiver systems. Again, in normal times, that would have been huge. That would have been like amazing. It's our job to share that word so that Iowa and other states take advantage of that waiver for people who truly need it, even in a tough budgetary time. Another thing we got was the extension of the ABLE Act provisions, including the Age Adjustment Act and a few more. We've made those permanent, so they will no longer sunset. We don't have to worry about fighting that every single couple of years. The ABLE Age Adjustment Acts and the Able to Work Act, which allows people to get some kind of income and still participate in the ABLE savings programs, those are here forever. They've been made permanent. So those two little nuggets were included in the bill. And finally, we really have to talk to our IDD community and educate them about what the work requirements do and do not cover. The work requirements, of course, are for the expansion population. Brooke, is Iowa expansion state? I'm
We
sorry, I
are.
don't. Okay.
Yes, we are.
Well, this is devastating because to Iowa, because we know that your state's going to spend hundreds of millions of dollars to put in place a system that has never been proven to work. That money could have been used for long-term sports. That money could have been used 100 different ways. Instead, they're going to chase after something we know doesn't work. And a lot of people will lose coverage, a lot of people in the expansion population, including people with disabilities. But what we need to remind the state legislature, and I am working with Brooke and with other executive directors, is that Congress was very intentional creating what they think is a disability carve out. So people with disabilities should not have to fall into that work requirement, should be exempt. And we need to work with state legislators and we need to work with the implementing agencies, which means your Medicaid directors, to make sure that the definition of disability is as broad as possible and as easy to meet as possible. I mean, I'm talking note from your doctor saying this person has a disability, easy as possible. So again, as terrible as this is, and it's truly terrible, it's the first time we've ever seen these types of drastic cuts to social services for the purposes of giving tax cuts to rich people. This is the first time in our history we've ever seen this. There are some things we can continue to do to educate our population and to help them navigate through the next 3 years, which will be difficult. So I'm happy to answer any questions about that as well. And I do hope you guys invite me back 100 times, like every month, whenever you meet, because I would love to hear your stories and I would love to hear your plans on how the state of Iowa intends to move forward, given the pullback of the federal government and this terrible changes that are happening to Medicaid.
Well, Erin, you are invited anytime you want to come. We do once a month during the summer, and then we will start back here in a couple of months doing them twice a month, just so you know. But you're happy to join us anytime. We do have a couple of questions. Deb Hobbs asked, "How will we know it won't just be rescinded and the money not used?" I think this is in regards to the HCBS funding that you were talking about, Erin. I don't know if you have a question for that, if it's more of a comment.
I think that's a fantastic question. I think that is one of the biggest challenges and changes in government we've seen. And in fact, one of the biggest threats to our democracy. This particular president has rescinded funds or decided to take the money that Congress has given for one purpose and not use the money at all, or to just take it away and say, we've changed our mind, that money's no longer needed, we're going to do it over here. So that's called a rescission. And it creates this problem where states, make a deal with the federal government on October 1st, in theory, to get funding, and then happen in this year in June or July of the year, the federal government pulls that money back and says, never mind, we need that money back. If this were like a business, they would be in breach of contract, right? It would be a breach of contract. But this is not business. This is government. But there is a real question as to whether the president is legally allowed to do that. So many education programs in particular were impacted by rescissions this year. Many public broadcasting was impacted by rescissions this year. International aid was impacted by rescissions this year. So going into the appropriations process, that's exactly why the 3 Democrats voted against the bill. They said they have no faith in this president that he will agree to the terms that Congress lays out in these bills. They're very concerned that this executive they use the word authoritarian, and will spend the money any way he wants to. Well, what the Senate committee did when it passed our bill, the labor HHS bill, is it put into the statute legislation that we call guardrails that says specifically the president cannot do that. This money is intended for what we say it's intended for. Don't mess with this. There's also guardrails that require the agency to report on a monthly basis how much money is going out, how many people they've hired or fired to get that money out, and a couple of other things. So this Congress is on to the president. And even the Republicans voted in favor of those guardrails because they do not want to create they don't want to put our country into chaos. We have to be able to rely on the money that is passed in Congress. That's what the Constitution says. That's the role of Congress. It is not the role of the executive. So when you throw the words around constitutional crisis, the Senate is putting in these safeguards to tell the president and to inform the courts if necessary that, this is a constitutional issue that we take seriously, and the president needs to report back to us and spend the money we say the way we say it. So we're hoping to see that language survive the House. In fact, I just got off a call this morning with a committee staffer, and that was the big point that we made, which is, yes, we want the program saved. Yes, we want the numbers there. But in addition to that, we want in the law that we know that the president is doing this thing and he needs to stop. Great
Okay,
question.
Erin, it looks like we have one more question here, and I think we might have to move on. It looks like George has his hand raised. George, do you want to come off mute and ask your question?
Yes, thank you, first of all, Erin, for joining. It's been really helpful. Recently, within Iowa, I don't know if you heard the story, but there was a really unfortunate death at a care facility. It was the cause was neglect. To be honest with you, that they were supposed to do regular bed checks. It didn't happen. What are other councils thinking? It got me thinking about how do we highlight the need for protections for individuals in facilities and just under care in general. Have you been hearing anything from other councils on what they're trying to do to highlight protection or cases of neglect or abuse? I would have loved it to be a national outcry, but it kind of just happened and wasn't very well publicized.
And first of all, I'm really sorry. It's tragic, it's terrible, and it's completely avoidable, and yet it happens all the time.
Yeah.
And
Yep.
in terms of public outcry, one of the tragedies of the HR1, the big beautiful bill thing, is that there was so much in the bill that people don't realize exactly how bad it was. One of the things in the bill that goes directly to this point is that Iowa and others had worked for years to require minimum staffing requirements in nursing facilities. And there was a notice and comment and rulemaking last year that we supported, that all the council supported, which would have put in place standards for the number of registered nurses as well as staff available at nursing homes at all times. And that had just begun to be implemented. But in the bill that passed, they eliminated it. So there's no longer a federal requirement to have those minimum standards for nursing home care. So where does that leave us from an advocacy perspective? I mean, we're all feeling like we're drinking from a fire hose, right? I mean, I didn't even tell you guys about that. Why didn't I tell you about that? I just gave an update because there's just so much. But we do live in a system, a federalist system. And when one avenue of advocacy closes, we've got to look to other avenues for advocacy. I think shedding more light on this, if you write a letter to the editor, for example, I think it'd be very important to point out that Congress had a chance to support this, and instead they turned the clock back. And I'd be happy to give you more details and cite the part of the statute that reversed that new law. We've got to hold people accountable. And I'm not talking about elections when I say this, but if I were the family or if I were anyone impacted by that, I would go directly to my member of Congress's office and I would say, you voted for this bill. My loved one died. What are you going to do to make this right? Because we're not even at the point, they know that this is a problem. The federal government knows this is a problem. They passed, the Biden administration went through the notice and comment, and we made these requirements, and Congress went and said, never mind, you don't have to care about minimum staffing requirements. And then this happens. Addition to that, I would tell my member of Congress, you voted for, or the president's put forward a budget that would cut the protection and advocacy budget by 2/3. So not only are you saying there doesn't need to be minimum staffing requirements, but you're also getting rid of the attorneys, or the president wants to get rid of the attorneys who have the power to go into nursing homes to advocate and protect people from abuse and neglect. What are you going to do about it? I want you to open a case for my loved one who's in a facility right now, and you are going to tell me how you're going to make sure that she gets adequate staffing. I think it's time to make our pain their pain, by opening up these cases and by pointing out to the public about these are not tragedies that require, thoughts and prayers. These are things that are completely avoidable that Congress has allowed to continue. And we need to point those things out. It's going to be a difficult
Very
time.
helpful.
It's going to be a difficult time for Iowa, guys. But I think that, going local, what is it? Act local, think global. We got to get back to that empowerment thing where we can talk to our state legislatures, we can talk to our Medicaid directors. And then when there are problems, we open up cases in our members of Congress's office and hold them accountable for rolling back the clock. Make them change it. Your constituents are dying. I want you to open up a case, my deceased loved one, and I want you to tell me how you're going to make this not happen again. And again, I'm
Thank
so
you for
very
that perspective. Yeah.
Thank you, Erin, for that.
Brooke, we have one other question. Deb Hobbs had a question about work requirements. She didn't put the question in there. So I don't know if she wants to come off.
I'm not quite sure how to phrase it. I've been asking around and I haven't gotten an answer yet. When these work requirements go into effect, who is keeping track of the cost savings, or I assume lack thereof, of the program as it's being implemented? And who is keeping track of people who are falling off the system because they just don't have the time or resources to complete all the paperwork that's required?
That's an excellent question. And in fact, Congress basically Congress said it's your problem, the states. All the states have to implement their own system and then report to us. They're not telling the states what system they have to implement. They're not telling them how to do it. They're not really telling them anything. They're just leaving it up to the states, which is why state Medicaid directors and state DD councils are so frustrated. Brooke will tell you that state DD councils, and I encourage your council, have been meeting with Medicaid directors for the past several months saying, how are we going to do this? Or how do you plan to do this? And they say, we don't know. You don't know? Well, what is Congress, what kind of guidelines is the federal government giving us to say, this is how we have to, these are the steps you need to take in order to comply with the federal government. Here are some best practices. What is the federal government telling us? Nothing. In fact, our Wisconsin DD Council reported 2 days ago that CMS told their director that they don't expect to have guidance on work requirements until June of next year.
Yeah.
Um,
Erin, we
and
heard
it's
something similar to that just today. Erin and I, Amy and I were on a Health and Human Services Council meeting where they were saying that our Health and Human Services oversees our Medicaid department because our Medicaid director, we currently don't have one that starts here on September 2nd. So it's been our Health and Human Services Director that we've been meeting with, but they are still waiting for guidance from CMS to implement a lot of this, is what we heard today. I think Amy's going to talk about that a little too, but yeah, it
Okay,
is
good.
frustrating.
Yeah,
But it's, sorry, go ahead.
no, I just agree.
Yeah, it's more than frustrating. I use big words. I don't want to use a big word. It's not making serious. I said this to a friend of mine who works for the ACLU. I said, I don't understand. Lots of states have tried to do this. None of them have been able to do it because it's either too expensive to implement, or the courts have shut it down because it denies people due process. So there's no proven model for this. And my friend told me, Erin, this is a serious problem, but we're not dealing with serious people. This was a talking point, getting rid of fraud, waste, and abuse. This is not how you make policy. Throwing it down to the states is doomed to fail. A top staffer for a senior member of Congress, Mitch McConnell's staffer, we pointed this out to him, and he said, well, Erin, we won't know how it works until it works. And I said, I don't understand what you're saying. And he said, well, we have to give the states an opportunity to innovate, and then it'll work. And I said, that is not the way you do policy. That might be the way you do demonstration projects. Like, a smarter way around this is, you really love work requirements, then give some state $1 gazillion to implement work requirements and see how they can do it, because we don't think it can be done. They did not do that. Instead, they've made this a crisis for all 50 states. I really sincerely do not think we are working at the national level to try to see a path forward, to try to see a way for advocates to make a path forward. But I'll tell you what, if I was implementing it, I wouldn't know how to do it. And I consider myself a pretty creative problem solver, but all the questions you raised in your very smart question are those questions that no one has answers to, not even the people who pass these laws.
Erin, this was so good. You have a
Yes,
great.
thank you so much, Erin.
I will put that link for the comment on direct support workers in the comments. Thank you very much. And I hope to come back again soon. And
Thanks,
I
Erin.
hope you don't. Thank you. Have a great day, everyone.
Thank you. Hey, I just put up for everybody on the screen, as Brooke mentioned, we were on a HHS council meeting today where they kind of had several resources available. So that link that you see on the page is the link to the August meeting. And there are several attachments, including one that talks about the changes to SNAP, the impacts on SNAP, which is food assistance, and on Medicaid. And I just kind of put, I know it's really small on your screen. I just put 2 screenshots of 2 of the 8 pages, I think it is, that's in that document. But it is kind of the beginning analysis of that Reconciliation Act and what the impacts are going to be on the state. I think the big one that they talked about is SNAP. Right now, their admin is covered 50% by the state, 50% by the federal government. That's going to change to 75% state, which means they'll need more money to continue to do the work that they're doing. But also, they use some of this money to be able to create their new system, their electronic system that George had mentioned in the chat, that is their sort of one-stop shop integrated system for determining eligibility and enrolling in benefits. So all benefits in one spot. It's meant to be a really super easy system for the user, but that would have been covered 50% by the federal government, and it's very expensive. I think like 100 million expensive. So I know Kelly Garcia said today that she has asked Medicaid, CMS to allow them to continue to do the 50-50 match, since this was already in the works before that bill passed, and they had depended upon those dollars. Also, she's working on a system that will make it, as she said, easy, very easy for people to be able to submit their work information, so that it is not a complicated system, and it's something that the user can see as well as the agency. So we'll see on that, right? How that gets rolled out. Also, there will be more frequent eligibility determinations for that expansion population. So it's really coming down hard. But the important thing to know is that the federal bill on work requirements was a little bit better than the state bill, because it did have broader exemptions. I think it was mentioned today up to age 18 will be exempted from work requirements. They didn't have that in the Iowa bill. It was only for caregivers up to age 6. There were some other changes that are different, but we'll cover those as we get more guidance, hopefully sooner than later. But you might want to go on that website and just check out some of the materials that they have posted there. Moving along, I'm going to do this really quickly because I want to have time to talk about elections, but a couple of state updates that have happened since we got together last. We have a new House Majority Leader, Bobby Kaufman, who's from the Cedar County, Muscatine County, just outside of Iowa City. I think he has a little still of Johnson County, maybe not, but he's in that area. He is the new majority leader. He replaces Representative Matt Winschittel, who's running for Congress, because Feenstra has announced he's running for governor. So he will be running for that Western district there. That means Bobby Kaufman was the House Ways and Means Committee chair. That's the tax writing committee. So when you hear about property tax reform, that's the committee that happens in. So they're going to have to make a new appointment. And I've heard the chairs from HHS, transportation, state government all want that job. So there's going to be some committee shifts going on, as well as our new state rep, who was elected at the end of session in Lynn County, hasn't been assigned her subcommittees yet. So stay tuned on that. We will update our legislative guide as soon as we get that information. We still have not heard if there'll be a new Senate Majority Leader or not. As many know, Senator Jack Whitver of Ankeny is continuing to be treated for an aggressive form of brain cancer. So he is still the leader, but many of his members are stepping up to kind of help out as he goes through that treatment. But again, if there is a new leader, we'll have some committee chair shifting going on. Also, just on Tuesday, the Democrat won in Senate District 1 over in the Woodbury County, Sioux City area. Caitlin Dre will join the Iowa Senate. And that means the Senate Republican supermajority will end. There will only be 32 Republicans, still a hefty majority, but any of the governor's appointments, which require 2/3 vote, which is a supermajority, require 33 votes. They would need 1 Democrat to support that. So it's probably not going to be a big deal this next year. Most of the appointments, controversial appointments, usually happen in that first year. So moving on, I'm going to turn it over to Carlin for an introduction to our Secretary of State guest.
Hey everyone, I'm Carlin Crow here, Public Policy Manager with the Iowa Developmental Council. And it's my pleasure to introduce our second guest today, Bailey Kelly, who is a member of the Iowa Secretary of State Paul Pate's office. As I understand it, she's new to her position. And we had asked, and I want to get a shout out here to the Secretary of State's office, because a couple weeks ago, they invited us to be at their booth at the Iowa State Fair to talk about voting for people with disabilities, and how we as an organization and other organizations like us in the state and the Secretary of State's office are working to make voting accessible as possible for Iowans with disabilities. So we had a chance at the state fair to talk to Iowans in the Varied Industries building, which were a lot of people that day. and also talk to the Secretary of State himself about their efforts to make changes that people with disabilities are asking for and need to make sure that they can vote in elections. And so at that, well, actually, the secretary himself said he would love to be on this call today, but he was kind of busy. But Bailey was able to jump on here at the last minute. So we're delighted that she's been able to join us, and had asked their office to give an update about the current election cycle, which we kind of all tend to forget about because it's a local election year, but don't forget that it's important to vote. And also some changes in voting regulations that came out of the last legislative session. So without further ado, Bailey Kelly, who is Director of Elections for the Secretary of State's office. Thanks for joining us, Bailey.
Thank you so much for having me. Can everybody hear me?
Yes.
Okay, wonderful. So yeah, I am relatively new to the position of Director of Elections, but I have been in the office for a little over 2 years, and I have been working in elections for about 5 years now. So I come from Johnson County, was where I got my start in elections. And we had a wonderful relationship with different disability organizations there, and we were really focused on training our poll workers on interacting with voters of different kinds of ability. So I am very happy to be able to talk with you folks. Looks like we already have all the important dates that kind of need to be reinforced for the upcoming city school election. I will say that these are the dates for the regular city school election, right? November 4th is election day. You can start requesting ballots to be mailed out to you. They will start to begin to be mailed out on October 15th. That's the same day that you can go into your auditor's office and vote there in person. If you want to petition your auditor, your county auditor, to have a satellite at a location that's not a regular polling place or not at the auditor's office, there was a change within the last 5 years or so that those have to be petitioned by the public. It used to be that the county auditor could just say, yeah, we're going to be at the public library for these dates, and they would make it happen. And now that they have to be petitioned by the public. So you can find all of that information on our website. Like you see, there's the link right there, sos.iowa.gov. The deadline for those petitions to be filed with the auditor's office is October 6th. So if you want to see voting at, like I said, a library or community center or anything like that, start circulating those petitions, collecting signatures and getting them into the auditor's office so they can start making plans for that. So in Iowa, we don't have early voting. We have in-person absentee. So everything is, if you come into the auditor's office or at one of these satellites that I mentioned before the election, and you cast a ballot, that ballot is going to be securely held and then delivered to the absentee board to be counted on election day. So results aren't being produced, nothing is getting counted when you come in and you cast your ballot like that, or if you do it by mail. So right, you get your ballot mailed to you on October 15th, you receive it on the 17th, you get it voted and put right back into the mail system, and then the auditor's office has it, you know, by the 19th. Then they just hold on to that until November 4th, and then the absentee board is going to be the ones to open them up and run them through the tabulators. At every so whether you go to the auditor's office or you visit a satellite location before the election, they will have the ADA machines, so the ballot marking devices. Depending on the vendor that the county uses, we have 3 different vendors that we have approved that are certified by the state to function in Iowa for the voting equipment. But all of them are required by federal law and by state law to have a ballot marking device, which is an ADA machine, which you can use. It's a touch screen. There's headphones that you can put on and listen to it. There is a keypad that has Braille on it that you can navigate around. You can even plug in the puff and blow devices to navigate it that way. So every polling place on election day and the auditor's office and every satellite is required to have that machine set up. I will be perfectly honest with you. Because they are relatively rarely used, sometimes it requires a reminder to the poll workers to get them set up and ready to go. But we do our best here at the Secretary of State's office to remind the county auditors to train their staff and their poll workers that those machines have to get set up every time by 7 a.m. on election day when the polls open, or anytime voting is happening at the auditor's office. It's a priority. The auditor's offices also, legally, they have to do it every even numbered year before the primary elections, but they tend to do it a lot more often than that, and especially whenever they have to move polling locations. They have to go out and survey polling places, regular polling places, emergency polling places, the satellite locations, and their own offices. And they have to follow the ADA guidelines provided by the DOJ to make sure that every space is accessible. So, right, no gravel parking lots. Ramps have to be at a certain grade. Any cracks in the sidewalk are going to have to be covered with using, we call temporary remedies, like, a rubber mat or things like that. So, it's a big priority for the auditors to make sure that every polling location is accessible. Curbside voting is available at every polling place. So you call the auditor's office and you say, I can't leave my vehicle. I need a ballot brought out to me. So it is going to be some back and forth because you have to fill out a form and show ID, and then they have to go back in and get the ballot and bring it all back. So, there is some back and forth, but that is an option as well for voting. You're also welcome to request assistance. So every poll worker will ask each and every voter, it doesn't matter what you look like, who you're with, how you present, every single poll worker should be asking, okay, here's the declaration of eligibility for you to sign to receive your ballot. Do you require any assistance in completing your ballot? And you can say yes or no. And if the answer is yes, you can have somebody that you brought with you help you fill out your ballot and they'll sign a form. Or there is a bipartisan team of poll workers that would be assigned to assist you in that case as well. So if you don't have to bring somebody to assist you, there will be poll workers at the polling place that will be able to assist you if you prefer to do it that way. Let's see. As far as so far this most recent legislative session, nothing really changed regarding voting with different levels of ability. There weren't any changes to timeframes or, it's still 20 days to vote early before to vote before the election, in person, absentee. Ballots get mailed out at the same time. None of that changed. So I don't have much of an update as far as legislation, unless there's something that I'm missing from the DCCI team that you would like me to speak to. But no big changes there. I will say that moving forward, we have been trying hard to get funding for a pilot program to begin exploring the possibility of online voting for certain kinds of voters. So overseas voters, military voters, and voters with disabilities. That's still going to be a priority for us. We haven't succeeded in getting that funding for that pilot program, but that is something that we are continuing to work toward. But otherwise, it's a lot of continuing to train the auditors. We've had a lot of turnover. Over a third of our county auditors as of last November had never run a presidential election before. That's the kind of turnover that we have right now in the state, the county auditor's offices. So our big priority is training and education. But I will say, based on my experience, oftentimes the poll workers know a little bit more than even the auditors do. They've been doing this for decades. And so we always want to get as much good information out to them as possible and teach them more about best practices. But you're in good hands. They're your neighbors, they're your friends, they're the people that you see at the grocery store. Poll workers are what really make elections happen. And I have complete faith in them, but I'm happy to answer any other questions that you might have about November.
Bailey, this is Carlin again. I wonder if you could comment about we have gotten some questions about voter, registration and people making sure that they're still registered based on their voting history.
So yeah, so if you did not vote in the last general election, then you would have been made inactive. If you stay inactive for 2 general elections, then you could go to canceled. However, you would be moved to canceled. However, you would have received notification of that. And so you would have gotten a card in the mail saying, if you don't want to be canceled, just sign this, check this box, mail it back to us, and you'll be made active again. I will also say, if you didn't vote just in this last previous general election and you were put into inactive status, the mere act of you voting will return you to active. And there is nothing additional that you would need to do at the polling place. So when you show up to vote, you are going to have to have an ID, which is going to be your Iowa driver's license, your non-operator ID, a passport, a military ID, or your voter registration card with your voter registration PIN on it, already signed. And all of this information is on our website on the elections page. You can also, on that site, you can take a look and type in your information and see what your voter registration status is. So if you're inactive, again, there's nothing different about the voting process. The fact that you request a ballot and then vote that ballot will make you active again, and you won't have to do this again next year. Again, there's no real change to the process. It sort of starts a countdown clock for us. So if you continue to not vote in elections, then after a few cycles, we're able to cancel you and get you off the rolls, because that probably means that you've moved and we just, for whatever reason, did not receive notification that you've moved. But you can check your status there. Like I said, make sure to bring ID. Even if you don't have ID, you can use an attester, which would be somebody that lives in the same precinct as you that does have their ID, and they say this person is who they say they are, and then you can vote that way. If you run into any issues at the polling place for whatever reason, these are the magic words. I would like to vote provisionally. No voter should ever be turned away, even if you don't have ID and you don't have an attester, you're not on the register, whatever the case might be, that they can't give you a live ballot, that's what we call them. They can't give you a regular ballot to vote and put through the machine to tabulate and get counted at that time. They always have to offer you a provisional ballot, which would be a ballot where the corner is cut off so that it can't possibly be read by the machine. And that gets put into an envelope and returned back to the auditor's office, and you will be given instructions on how to, what we call, cure that ballot. So if you didn't have ID, you come back to the auditor's office within a week and show them that ID, you know, whatever the case might have been, to get through that process. But ask if, and this is the tricky one. Like I said, I love to praise my poll workers. They're amazing. They've been doing it forever. They know a lot. Sometimes they have to be reminded. Everybody gets offered a provisional ballot, no matter the situation. Sometimes there is no cure for it, but you never, ever turn anybody away from voting. You always get offered a provisional ballot.
Thank you for clarifying that, Bailey.
I just,
Any other questions?
oh,
Go ahead.
to plug in your website, Secretary of State's website has been updated, and there's some great videos for people to watch. So if you or someone you know in your community has questions about absentee voting, voting by mail, in person, I mean, the videos are so clear, plain language, very, very comprehensive. So just want to put a plug in that. And Bailey, it's great resources on your website.
Great. I will go share that with Ryan. He worked very, very hard on those. So I will make sure that he gets that compliment. Yeah. We're trying really hard to you know, educate the public, educate our auditors, educate our poll workers, and just make sure that, you know, the voting process goes smoothly for everybody involved. And then one last thing I want to say just about this November. Carlin's right that this is a local election, so it's your city councils, your school boards, and your community college trustees. You might have a public measure or two thrown on there as well, for your cities or your schools. November 4th is the regular date. You might be in a community where they have either city primaries or city runoffs, which would be 4 weeks before or 4 weeks after. Your county auditor is going to be the place to go for that information. Again, you can request ballots now. That period is open. They won't get sent out until October 15th, but yeah, just encourage you to check our website and your county auditor for any other information. And if you see anything, or if you have an experience at your county or your polling place, whatever the case might be, and you feel like something could have been done better, we want to hear about it. We want to be able to reach out to the auditor's office, ask, you know, exactly what happened in that situation. We want to be able to correct and train and find out how we can just keep making improvements in the voting process for all voters in Iowa. So please feel free to reach out. Again, sos.iowa.gov has a form that you can fill out. It has our contact information. We want to hear about the positives and the negatives that you experience when you're voting.
Thanks, Bailey. Really appreciate that. I know we only have a couple minutes left. We had such good speakers today, but I wanted to obviously remind you to vote. But secondly, as Erin mentioned, there is a rule moving through the Department of Labor that would no longer protect direct care workers, personal attendants, aides, wages, so not guaranteed minimum wage and not guaranteed overtime. That they're actually rescinding or removing a law or a rule which would turn the rules back to what they were in the 1970s and treat caregivers like companions or babysitters. Now, not only is that disrespectful to the people that provide that important care, it's also going to make things more difficult with the shortage. And so we have created a direct link here to our Take Action Center. You can scan it. All of this is up on our website now. This entire PowerPoint presentation is under Capital Chat, under InfoNet on our website. And you can go directly there to submit your comments, or you can use the link in the chat that Erin supplied. We just can keep count of how many comments go in if you use the system. We started it off, but I always encourage people, please add your own personal angle to it. Tell your own experience with caregivers and their importance in that. But or you can just submit what we wrote up. So, and last bit is a plug for October. Just seems like a long way away, but it's not, guys. Disability Employment Awareness Month, and some of you know have taken advantage of bringing your legislator to spend part of your workday with them and learn about your job. And you can learn more about it at that link. We're already starting to get people signed up, so we have them on the calendar. So if you are interested, take a look at that information there. And then lastly, I can get my screen to move. Got some capital chats coming up. That's the rest of the year. There are hour format once a month. We skip November, kind of do a between the holidays one and December 5th. So, because we know it's a busy time. I do want to thank our interpreter who hung in here with us another 2 minutes. I appreciate you. And with that, I think we are done, right, Brooke? Did I miss anything?
No,
Oh, sign up for Make Your Mark.
oh, we do have, you still can sign up for Make Your Mark. We are already at 200 people. So if you are interested in attending our self-advocacy conference, please do that here in the next couple of days before we have to close registration. And that's September 18th and 19th. So you can find all of that on our website too. And have a happy Labor Day, everyone, at Labor Day weekend.
Thank you. Bye-bye.